Hey there! Today we're diving into a topic that's often misunderstood: schizophrenia. It's a serious psychotic disorder where a person experiences a break from reality, seeing or hearing things that aren't there, or believing things that aren't true. As per the ICD-11, schizophrenia affects thoughts, emotions, and behavior. These symptoms affect how someone sees the world. Symptoms are divided into two types. Positive symptoms. These include hallucinations, delusions, or disorganized speech. We might say that something abnormal is added. Negative symptoms. They involve lack of motivation or flattened emotions, indicating something is missing. For the record, it's not about having multiple personalities. It's about a mind struggling to connect with reality. Schizophrenia symptoms vary, but some of the most intense involve delusions, or in simple words, strongly held false beliefs. There are a few key types. Persecutory delusion is when you think others are trying to harm you. Grandiose delusion, it's believing you have superpowers. Referential delusion means thinking random events are secretly about you. Also, hallucinations are also common, especially auditory ones, meaning hearing voices no one else hears. Let's dive into a fascinating story. Aneja et al., 2018, explored the journey of a young boy grappling with early onset schizophrenia. Imagine this, at just 12 years old, he began hearing voices and felt that others were controlling him. His actions became erratic and he started to pull away from those around him, highlighting how quickly schizophrenia can take hold and transform a life. Curious about what triggers schizophrenia? Stay tuned as we uncover that next. What causes schizophrenia? The answer: a mix of biology and psychology. Genetics play a big role. Gottesman, 1991, found the risk jumps from 1% in the general population to 48% if you have an identical twin with the disorder. Then there's the dopamine hypothesis. Too much dopamine in certain brain areas may lead to hallucinations or disorganized thinking. There's also a cognitive explanation. Frith, 1992, said schizophrenia involves faulty self-monitoring, like mistaking your own thoughts as coming from outside. Nature and nurture both matter. Genetics might load the gun, but environment pulls the trigger. Coming up next, how do we treat a disorder this complex? Let's talk about treatment options. Schizophrenia isn't curable, but symptoms can be controlled. At times, this can be effective. Most treatments start with antipsychotic medication. There are two types, typical and atypical. Typical antipsychotics reduce dopamine levels, but come with more side effects. Atypical ones, such as clozapine, help with both positive and negative symptoms and have fewer side effects. Another approach is cognitive behavioral therapy, or CBT. It helps in challenging thoughts and hallucinations. Research by Sensky et al., 2000, showed CBT reduced symptoms even 9 months after therapy, outperforming casual talk. Let's consider electroconvulsive therapy, or ECT. It's still used today, but is safer and modern. It's mainly applied in severe or catatonic cases as a last resort. The best results often come from combining medication and therapy. We'll end with a look at ethics and its impact on real life. Studying schizophrenia goes beyond science. It's about understanding people. This raises key questions about ethics and behavior. Consider the case study by Aneja et al. They worked with teens facing early onset schizophrenia. How do we ensure these young individuals truly understand consent? Can they opt out if they feel uncomfortable? There's another study by Freeman et al., 2003, that used virtual reality to simulate paranoia. They discovered that anxious people often saw avatars as hostile. It was safe, yet it raised concerns about psychological stress. Now, the larger debates. Nature versus nurture. Twin studies reveal that genetics play a significant role, but they are not the sole determinants. Adoption studies further clarify the distinction between environmental and biological influences. The conclusion is clear: both nature and nurture contribute to the development of schizophrenia. Idiographic versus nomothetic. Idiographic approach focuses on understanding the unique experiences and characteristics of individual cases, and nomothetic approach seeks to identify general patterns and principles that apply across a population or group of individuals. Aneja's case study exemplifies idiographic research by providing an in-depth look at one person's experience with schizophrenia. It captures the specific symptoms, behaviors, and challenges faced by this individual, offering a detailed and personalized perspective. On the other hand, Sensky's trial represents nomothetic research by examining a larger sample of people with schizophrenia. It aims to uncover common symptoms, treatment responses, and other trends that can be generalized across the population. By using idiographic and nomothetic methods in tandem, researchers can gain a more nuanced and holistic perspective on schizophrenia. This dual approach enables the development of both personalized treatments and generalizable interventions, ultimately improving outcomes for individuals living with the disorder. When studying schizophrenia, our goal extends beyond merely learning about the disorder. We are also learning to treat individuals with empathy, grounded in evidence and guided by ethical considerations. Thank you for watching. I hope this information was useful in your learning process. And if you have any questions, feel free to leave it in the comments box, or you can always send me an email. See you soon. Goodbye.